Thank you, Lord, for standing by me and touching me. Touch all of us as we are in this meeting today. Touch our hearts. Guide us to have a clean mind and a clear heart. Let us be able to be on one accord. Let us be in harmony and peace. In your precious name we pray. Amen.
There's somebody trying to join on the other link.
It might be Donna. It might be Donna.
But I sent you this link. Can you see it? Do you speak with it?
No, I didn't want to see with it.
No. It should have popped up on my. You see something?
Does your job.
All right, I can go to this.
Go to item number 4, public comment.
Anybody here? Comment? I see none.
You're all set there. Let's go to item number 5, regular agenda. Discuss and approve meeting minutes for the Veteran Rising Board for July the 8th, 2025.
Were you able to review the meeting minutes? I sent them last week.
Minutes, yes.
Yes.
If I take a vote, all ayes.
Motion to approve the minutes?
Yes.
Second?
Second.
All in favor?
Aye.
Anyone opposed? Motion carries. Let's go to item B. Receive a presentation from the Rosa Guillen, Texas State Veterans Home on current capacity services and waitlist challenges, followed by the open discussion with the veteran community.
Hi.
Hello.
Okay, that was quick. My name is Dee Dee. Most people call me just VLB Dee Dee if you're trying to recognize what my name is. I work for the Veterans Land Board. I am the on-site representative for Ambrosio Guillen. And what that is, in short, is someone who oversees the contract that is being ran by the contractor, who is HMR VSI. I ensure that they deliver in all aspects of what they're supposed to give the veterans according to their contract. And then I also do just minor overseeing inspections, lightweight inspections, just to make sure that none of the veterans' rights are being abused, and to ensure that the veterans have what it is that they need. What I have is just some facts and information from me. So Tony wanted to know a couple of different things. Do y'all want me to go ahead and clarify those things right now? Okay, so Ambrosio Guillen, if anyone knows, it was opened in 2005. We just celebrated our 20th anniversary operation on July 18th. It has a capacity of 160 beds. It has a traditional unit, and it is primarily for veterans who are unrestricted in mobility. It has a memory support unit. It also has a special care unit for wheelchair-bound amputees, someone who needs just special assistance with daily living activities, eating, and things of that nature. So veterans who have served for a total of 90 days on active duty who were honorably just discharged, who have 70% or above, they can live in the residence for free. However, if you're non-service connected and you meet one of the following, such as being a spouse of a veteran, or you are a Gold Star parent, you also are authorized to live within the building. Now, when veterans are below, we're just going to concentrate on service connected. When veterans are below 70%, they do have to pay out of pocket, but the VA meets those wages. And so one example of that would be, and these are not real numbers because I do want people to reach out to the administrator and to the director of admissions to ask, because these numbers are fluctuating numbers. So say if you were below 70% or you're non-service connected, right? And if the rate was at $200 a day, the VA for veterans will cover $185 a day. So that may leave you with a $15 balance, and then you multiply that by the number of days in the month, 30 or 31. So you can end up paying $465 to about $500 if you're non-service connected, if you are a veteran that is below 70%. Tony did ask me to discuss some things about like the budgets. Unfortunately, the budget itself, the operating budget is not made public. So I cannot disclose those numbers. However, what I could do is anyone who is seeking to either build a home or go into business with the Veterans Land Board, I can get them to the appropriate parties. I have no problem with doing that and ushering them through if they're seeking to open something that is similar to what we already have. This is a state-funded facility, and it works in conjunction with the federal government as well. So it has a lot of oversight, and that's why it's a lot better than traditional private facilities, because the veterans' rights come first. The veteran comes first. And you know how they say in business, in customer service, that the customer is always right. That's pretty much the case with our veterans. They're pretty spoiled. So and it's not that they don't have complaints or anything like that. They do, and they're taken seriously. So there was one other thing I wanted to make sure. Oh, okay. So the Texas State Veterans Home, we have 10 locations. Those locations are Amarillo, Big Springs, Bonham, of course here in El Paso, Floresville, Houston, McAllen, Temple, Tyler, and then our newest location, which just opened, is in Fort Worth, Dallas. So say if a veteran, if we were full to capacity and one of the other homes had availability and the veteran wanted to move there, their family there are there, they could put in the application and be possibly accepted at that place depending on their availability. And I think one of the things is that you wanted me to debunk the waiting list. So the waiting list, it does vary. The most that I've seen since I started working, and I started working there, I took over the role in January, is up to 6. Unfortunately, it fluctuates really fast. Sometimes it can fluctuate slow. Right now, we have 2 on the waiting list. Well, we had a total of 4. All 4 now have rooms, and we're waiting for them to move into the facility. And that happens, unfortunately, due to, residents passing. And that's just the nature of the beast, with residents passing. And then there are times when if they are well and they're there for short terms, then the numbers could open up quickly. If they have been discharged because they're going to go home and be with their family members to, pass away in comfort and peace, then of course those rooms will become available as well. I don't think I have anything else unless someone has any questions of something that I didn't cover.
Concern on the budget, is that because of requesting new facilities?
I just, because
I don't think we're
I'm trying to
budget.
debunk. Yeah, I really didn't. I'm trying to debunk. There's this perception that it's so overfilled that we're going to have hundreds of people waiting, and that's just not the case.
No.
When you're asking for another facility or even an annex to that facility. So I kind of explained that to you. I do have a couple of questions. One, if a veteran is 70% or higher and they're on the waiting list with somebody who is less than or not service connected, is there a priority to that? Like, are the service connected veterans prioritized first, or how does
Yes. So the veteran is prioritized. Mm-hmm. However, say if the veteran is prioritized and they have not submitted all of their paperwork that goes with the packet, and I have a copy of one of the packets. I have 3 because it's pretty thick. If they don't have their packet, we will wait on them, but we're not going to wait 30 days for them to get their packet together. And so it then becomes a first come, first serve basis. We do have the availability where they have a certain select number of rooms that are assigned for non-service connected veterans, and then the veterans themselves, but those numbers are smaller than for the veteran. And who knows, it could be someone that may need to be in the traditional unit, in the memory support, or someone who fits the bill of specialty care, and that matters as well. So a couple of different things are taken into consideration, but the veteran is absolutely prioritized.
Yeah. First, I want to say thank you.
Oh, you're welcome.
I was blessed to go there twice. One was for my neighbor, Kobe's husband, former Sergeant Bruce Porter, and recently for Seaman Third Class Robert Millard.
Okay.
Recently passed. Both times I went there, for that reason as a level of honor
Yeah.
for these gentlemen, or for these warriors.
Yeah.
Who've done their time, who raised their hand, said, "Send me,"
Yeah.
and they went, and they came home and their country took care of them, even to the last day. So thank you for that.
You're so welcome. Thank
The
you.
question is, we start going into a new era of what we call war veterans.
Mm-hmm.
Is there any analysis or algorithms you guys use to say, hey, we might have an influx that would require, I think our World War II guys, God bless them, they're out there keeping heaven safe, but you have our Vietnam veterans starting to, I don't want to say fade out, but they're leaving us too.
Yeah.
But now, we talk, we have that Gulf War, influx coming, that hill's right ahead of us.
Yeah.
Is there any data out there that says, hey, you see at your end,
There will be an influx. So we have right now in El Paso.
Is prevailing somewhere.
Yeah, absolutely.
In El Paso area is 60,000 veterans now. The VA, we got roughly about 35 to 40,000 signed up with the VA. It's 20,000 unaccounted for that out there. They haven't.
Right. Do you have the numbers broken down by area of service? Like,
yeah, they do.
The VA has it.
Yeah, they have it. They have it broken down. Yeah, they have all that.
They won't let us share it, but I've seen it.
Yeah, they have it. They have the information.
It's 31,000.
Like I said, I recommend you guys to go when the director has his quarterly
The VSO meeting?
VSO meeting. He always presents those numbers. He presents how many veterans are getting care, how many veterans in the community, how many veterans are not.
And it is broken down. There is
broken down.
Vietnam era, Gulf War.
They got it broken down.
9/11.
If you're interested in that
Area
meeting, let
code.
me know and I'll connect you with the organ. I do attend that meeting, so.
So it's a great meeting because it gives you updates about all the new programs that are coming up. It gives you meeting information about some of the new projects that are coming up, information about the new VA being built and some of the other community-based outline CBOCs that they're building for those needs. And then he'll have the subject matter experts for each one of those departments that go along with that. So he doesn't talk all the time. He just passes the line. That way everybody can speak.
It's on Teams or something?
It's on Teams also, but it's
In person.
in person is better. You get to talk to him.
Yeah, if you could get them, increase the bad.
I think, there should be one coming up in like
It's coming
September.
up. It's coming up soon.
Yeah.
But I know you have federal funding to help expand those needs, where state funding
Mm-hmm.
can be more restricted,
It is.
and challenging to get a grip on it. So
Yeah.
get money on that.
Yeah. And just a caveat on just what he was saying, when it comes to having those different areas broken down. So that information then is also shared with the Veterans Land Commissioner, Dawn Buckingham, and then her team. And what they do is they are speaking about, and I've heard the rumblings of whether or not if we're going to do different annexes, the need for them, the need to build additional support units or whole Texas Veteran Service homes. When they're going to break ground, if they're anywhere close to doing that, is so far above my pay grade, I would not know.
Is there anything projected for, I know, say Lower Valley, say Lower Valley would like to have veterans home, not saying.
Yeah.
Is there any data that you guys work with to say, hey, that would be a potential project, or?
Yes.
Or is it a squeaky wheel that kind of drives us?
It is not a squeaky wheel that dries up. It is something that is actively being spoken about as far as where, like, say, for instance, in El Paso, would we do another veterans home? So she does recognize the need for having one in the potential of on the west side, in the lower valley, because we do have the one that's in the northeast. And she's the person who could authorize the land to be set aside for those purposes, whether she, whatever she has to do in order to get that land. But as far as close to being breaking ground or a solidified plan, I wouldn't have any knowledge of it.
That's fair enough.
Yeah.
Because we don't, what we hate to see is 20 veterans under a bridge sick, saying, okay,
Mhm.
that's our data. Well, we're better than that. I know you guys.
Yeah, absolutely.
Is there other drivers out there to say, before our veterans are sick under a bridge, can we get them to a home?
Mm-hmm.
That homes, build one, I'm sure it takes 10 years.
Yeah, I'm quite sure. But there are also other veteran advocacy programs that are out there for veterans who are homeless within the city. Yeah, and then the different homes that the VA also extends payments to for them to take care of the veterans in the event that they are on the waiting list and they need to come and be in our place as well.
So
Yeah.
if there's veterans on the wait list to come to your home, they would find a place for them on the interim, or is that?
Yes, so we have all the departments, like, so for example, if it's a homeless veteran, we have our homeless team.
Sure.
We also have if a veteran needs in-house services, we have our home-based primary care team. We also, if they need nursing homes, the NIC team will take care of that. So we have different teams that take care of all those different things from the time that they get separated from the service to the end of life, all the way to the cemetery.
Yeah.
I just wanted to add a comment and a compliment. I've gone several times before you knew me or whatever.
Yeah.
The residents there who just love company. They like company just to sit with them to eat. They'll help them eat their meals. Just that they don't get visitors that often, especially if they're not from here. I took it upon myself to be an advocate to register them to vote, because once they go there, their address changes and your ID has to match your ID to vote. And then try to set up something so that they wouldn't have to go outside in the weather to vote. So little things self can do. We can always look to find something, if it's nothing but to hold a hand, listen to their memory lane stories, watch their smiles. I've done their lipstick, let's go do a little lipstick and push the lips on it and see who has the best set of lips, and that's who wins the beauty contest. It's stupid stuff, but it's meaningful. I mean, crazy for us, meaningful for them, because 5 minutes is like a lifetime of a day for them. So I just thought that I would comment on that. And I like that the staff is very engaged and very caring.
They are. They absolutely are. And I know that I'm blessed as one of the on-site reps, because I hear about the different contract holders in different places. And so everyone that comes to visit my building, whenever any of the other on-site reps come in, I have one today. She's like, "Oh my God, your staff is amazing." The staff here, they're not my staff because I'm not in charge of anyone, but that's what she says. And you're right, DeBoe. Anyone is welcome to visit the facility. You could take a tour of the facility. The only thing that we ask is that you don't videotape, you don't take pictures unless, a veteran agrees to the pictures and things of that nature. But you're more than welcome to visit. You're more than welcome to come by. It's not something that is so closed off to where no one could come there, inquire, ask questions, and all of that good stuff. So everyone is welcome.
For the holidays, we did like a Christmas Valentine combination. We did the candy heart box, a little red one that you get at Dollar Tree. And we did a little we partnered with Walmart, got the little $3 roll-up blankets. And we taped them together and took a roller buggy and went through and gave all the women Valentines and love for the day. You didn't get included. Anyway, and we loved too. You're amazed. And like she said, we asked if we take pictures. And that was the permission we got. And it was so heartwarming, and it was worth it. It was that's what makes me happy.
It's a beautiful place to live.
Any other questions from the
Well,
board?
there's one more. And that's one thing we'll work with Nancy Peters, I think, is really good. The unattended funeral we go to. We're trying to make contact with those veterans who don't have family members. So I don't want the last time we say goodbye to them is at interment day. Saying if they are available, opportunities to go say goodbye to them. I know she's trying to put together a list now, those that don't have any family members. It's tough. It's hard. You got to think about that. Be in that position. Right? Not to have no more family left except and for their family. Right? So she's working that numbers. I know Mark Biello's working those numbers.
We have our.
You are.
We do the last remembrance. We also go to the unattended funerals. We pass out the information. The Marine Corps, Mr. Wade, he does all the salutes. The chaplain Huey from he does all the. If you guys need services for chaplain, whatever, just let us know. He's always at your service. So we got all those resources at the VA. I just don't know if everyone is aware.
We're not really looking for resources. Look and say thank you.
Okay.
Spend a couple minutes, say thank you. If they're able to communicate, listen to the stories, which is huge. And because those guys won't be forgotten.
Absolutely.
Unfortunately, right now, the last time we say goodbye is unfortunately at the unattended funerals. You want to back that up a little bit and say goodbye to them. Let them know that they're loved and cared for, and we appreciate them. That's great.
Absolutely.
Okay,
Luther put his hand up.
Yes, sir.
Hey, quick question. So I know you said 70% VA disability is one of the eligibility requirements. What are some of the others? Is it like age, their physical conditions? Does it need to be doctor referred? How does it work? Like say, I hate to say this, but if I need to put my mom there in a couple of years, how does this work?
So your mom would have to either be the spouse of a veteran in order to
She's a
qualify.
veteran.
Okay, so a veteran, spouse of the veteran, or they could be a Blue Star parent that can live in the facility. You don't have to be doctor referred. You could just be in need of being able to live there and meet the conditions, such as we have like the traditional care. If you come into the building, you've been there, right? You'll see veterans walking around unassisted with canes, the whole gamut. And so if you just express the need to be there, you fill out the packet, then that is your need to be there. And if you are 70% or higher, then the VA covers all of your stay. If you're below that, then you have a certain amount of money that you have to pay yourself out of pocket.
So then my question is, okay, so what makes it, this is probably a dumb question, what makes it different than a homeless shelter? What if some person's like, well, I have the need, I want to live here?
Okay, so the homeless shelter, again, they would have to meet the need of being a veteran, the spouse of a veteran, or they would have to be a Blue Star parent and then fill out the packet. And if they have 70% or above, they are authorized to be there. So yeah, it's just that simple. There's no games, no gimmicks, no anything like that, no other special qualifiers. Just meet that.
There than the OC, so.
Absolutely. And the building, the one thing that I didn't say is that the building is filled with, like, we have the whole gamut of daily activities, exercise programs, physical therapists, all of those things. The medications are being given to them and prescribed because it is a 24-hour, 7 days a week living assisted facility. And so veterans there, I'm going through now the process of getting our furniture. We've already some new furniture because, what we have is 20 years old. And when I came in, it was a big undertaking to go ahead and get all of those things ordered. And of course I have my team, it wasn't that hard of a thing to do. The money was there set aside. And that should be coming in at around December timeframe. We also have gone through some other upgrades, like installing a HEPA filter inside each and every room so that it limits the transmission of viral activity and all of that good stuff too. So it's a pretty good place to be. The veterans are not restricted at all. They can come and go as they please. They have their transportations to their appointments. They can utilize other services to take them different places. Like there is, and I just learned this a couple of months ago, Uber veteran who will pick up the veterans for free if they wanted to go out. They do activities like going to the casino, Walmart, just other stuff. We have a fishing trip coming up. So I just bought them a whole bunch of like fishing equipment and all that good stuff. We have a mini range on the property where they can, I'm going to order them some more stuff because they, it's broken. So I need to fix some things for them where they could go out there.
Golf range.
No, shooting range. Yeah, shooting range with BBs, not live rounds or anything like. No. You don't want that. You don't want that. No, because sometimes they do get into fights and arguments. Yeah. But it's a pretty amazing place, and I don't even call it like we don't call it a nursing home. I make it a point to say the resort. Are you leaving the resort today? Because it's literally like that. So yeah.
It's a sound that brings life back.
Yeah.
They're saying the nursing home, veterans home.
Exactly.
Resort, so that puts them, gives them a realization. Also, they know what I feel it sound like that's what
I got one question for
surviving
spouses. Can they also use the Rosa VA, let's say after the veteran already passed away, they get sick within certain years and the veteran was 100% she getting DIC, would she be entitled to go to Rosa VA also as a surviving spouse?
A survivor, yes, as long as she was the spouse of a veteran and they were still married. Yeah, so you still have to have been married. You can't be the spouse who has divorced. So if you lost your spouse through death, you still are the spouse of a veteran. Mm-hmm.
Does it matter if they're the spouse? Does it matter what percentage the veteran was at?
No, it does not, because you're the spouse of a veteran, so you qualify, you meet that qualifier. Because you are, the spouse is non-service connected, then you have a fee that you would pay out of pocket. Yeah. Yeah, for non-service.
Oh, for non-service,
Yeah.
but they're service connected with the IC is no.
Yeah.
Right?
70% or higher. Correct. Yeah. And then if it's below 70%, it's a small percentage, like the numbers that I gave, that the VA will meet more than half of that because you are the status of a veteran.
I think there's just a lot of misconceptions about, and thank you so much for coming, because
Sure.
the first thing, and this is what I hear from the veteran community, is that when they go there, the first thing you notice is it's impeccable. The cleanliness there is impeccable.
Thank you.
And I never noticed because, you know, a veteran asked me, he's like, well, what do you smell when you enter there? I was like, nothing. He goes, yeah, if you go anywhere else, it smells like pee or whatever.
Urine.
And so thank you for what you do. Are there, Javier, did you have questions?
Hi.
Javier's the Senior Policy Advisor for Precinct 3, Commissioner Bean, but it's the Lower Valley that came to us with those questions.
Okay, sure.
Yeah, part of our group that I go to is the Lower Valley Veterans Alliance. It consists of leaders of each of our veterans groups from Isleta to Tornillo, Horizon. So basically Far East, Paso, Lower Valley. And one of the part of our discussions here looking at gaps that we feel we can go back to our local groups and ask. And so we asked, and so one of the things that they believe is a gap is more of what you have, basically, but for their area. So my question to you is, I know it's hard over here to figure out, funding is always going to be the hard part, right? It's figuring out the grant. But my question, I think I heard you say earlier, you said there's a waiting. Is that 6 months?
No. So the waiting list vary anywhere from 2 to 6. Right now, we don't have a waiting list.
That's better, right? Or people.
Just for people that meet the qualifiers, not whether they are a veteran, spouse of veteran, or if they are a Blue Star payer. So those are the qualifiers that you need to meet.
Oh, so there's no waiting for veterans.
Yeah, there is no waiting list currently right now. We only have 160 beds, and so we just filled that last bed, but unfortunately the turnover rate could be anywhere as soon as 30 days to 6 months to potentially a year. I have not been there a year, so I haven't seen the waiting list be extended for a year. Right now, there's currently no one who has applied that's waiting on a bed.
But would you, I don't know, agree or that the need is high?
Oh, I'm quite sure that
if we look for the data, which is what we would need to find the data, because those are the kind of things that Grant would be asking. One last thing I wanted to just make a point on, that's just for everybody, is that I met with Congressman Gonzalez's staff recently, and he was basically asking where could there be funding opportunities, things that veterans is definitely one of his highest priorities. And so I brought that up, and so he just says, well, let me get some more info on it. So I guess anything that you could share that I can get from Tony, I guess that.
Yeah, absolutely.
Or like an annex type of.
And I spoke to Mr. Garza from Congressman Gonzalez's office, and I invited him to this meeting, and he did share that there is a VA clinic in Horizon. So when we went to the meeting in the beginning of August, first they were asking about an additional or an annex of the Ambrosio VN.
Gotcha.
And I went back and I told them, look, the waiting list that you think that there is not actually there. And you're talking about building and then operational costs as far as like how we could do this. And then they asked about a clinic for the VA. So I was very strategic in how I set up these briefings today so that you could wait and then the VA would be after you. But then they asked about clinics, and I know there's a clinic in Horizon, and Congressman Gonzalez is looking at potentially another location in the Lower Valley to try to get funding to build an additional clinic, but I don't know where that is, and I don't want to speak for him. But I think that was a concern, if I'm getting it correct.
During your time there, Dee, how big has the waiting list been? Has it been 10 people? Has it been 15?
No, 6.
She said 6 to max.
Yeah, see, I think that's the heart of the question there. If it's only 6 people that are on this waiting list,
You can't justify.
I think the data though is because the need is just, I don't think is documented. So like, for example, where we're talking about Jacob's Throne, where a lot of these hospitals that are already holding folks, a lot of those are veterans, but they're in the regular hospital. And I'm pretty sure if you give them a choice, want to go with your veterans or do you want to be stuck to the, a lot of those would say, well, inside, so all those are people we don't document. Sure. And I feel like the need of, if we were to kind of do some kind of documenting of all these veterans that are just kind of just placed all over the place.
Yeah, and it puts an undue burden on the community.
Well, the VA should have, the VA should have that data though, because when they go, like say, I had a veteran that fell and hit his head and needed 24/7 care. Yeah. I think he went to a facility off of US 54 and then they applied for residence at Ambrosio PN while they waited. So the VA should have that data of how many people we have at White Acres. We have all these facilities that work in conjunction with the VA. We just, I mean, us as a VAB and us as the public, we need to know who's where, and maybe like that may give us data. But
maybe I could work with somebody.
I think, yeah, you can reach out to us, and then you can work with patient experience. Patient experience, and they will give you those numbers. They get you those numbers. I think the like I was talking to Mr. Luther. I think it's more about the same thing with the issue we have at the VA. It's not about that it's not there. I think it's more of the awareness of what's available. That is the main issue. Folks don't understand how to reach out to these services. They don't know it exists. Especially because I always talk about we as a service member from all walks of the services, right? Sometimes we don't understand how to get information, or because of the reason we got out of the service, there is some misconceptions of people. Oh, I don't qualify for that. I don't qualify. Some people say I don't qualify for the VA, which is not true. All you got to do is go to eligibility. Hey, can you run my social security number? They'll tell you what you qualify for, what you don't. But people sometimes, because of the way they got out, I only did 90 days. I got taken out of boot camp, whatever. People qualify for things even at boot camp
or
level.
Even potentially, we have a lot of people who went to the VA 20, 25 years ago, had a bad taste in their mouth, and never set foot back in. Like I have veterans, and I'm like, I will go with you to register. It is not. I can promise you that the El Paso VA healthcare system is not your uncle, your grandpa's VA. It is changed, and you should see what's available to you.
And I can tell you this, I'm gonna add something to Ms. Hunt. And people, I don't know if people know this, and you guys need to start telling folks this. We are the number one clinic in the United States of America. Oh, yeah. We are the number one performing clinic in the United States of America. Our wait times are consistently low compared to anybody else. Me, myself, I'm a veteran. And when I go out to the community, I'm like screaming at my doctor, don't send me out there no more. I had to wait at UMC 3 hours the other day just to get a liver scan. And I'm telling you, at the VA, whatever your appointment is, that doctor's going to spend that time with you. He's going to look at you and let you talk, let you speak, and tell them what your problem is, and then they're going to refer you out when they need to refer you out because they don't want you to wait.
And that kind of gets to my point, which is a lot of these veterans that are placed in all these places didn't really have a choice. They're just there, and I'm not sure if they're happy or not. But if you imagine that they get a choice, whether it's like, well, there's this annex facility that's going to be your peer, your veterans, and I can't say for sure, but I bet you a lot of veterans are going to say,
some of them may not have
an
advocate. They may not have somebody that advocates to give them the knowledge.
That's why we're working to bring, especially to the Lower Valley, bringing those resources to them so they know that they're part of this community. And like, that's why I try to make my voice known there. Because they are important. They may not know, and that's why I tell them, like, if you want a specific resource, we can reach out and bring that resource to you. I just need to know what specifically the veterans in that area need. So it's just an open
I'll work
dialogue.
with you to try to get that data.
Yeah, and we
give
did
you whatever you need to, like whatever Greg, give Congressman another, whatever he needs to maybe put something together that's maybe not just clinic, but also maybe the whole facility or something.
And we did a PACT Act last year in the Lower Valley, the Segundo Barrio. So, and then we did a PACT Act at Isleta. So we've been reaching out to that community and doing the claims and make sure that those veterans are connected. As a matter of fact, we do it all over town. So we just did one at the Beast not too long ago. We did one for women, just because sometimes women don't feel like they, appreciate it, but they are.
You feel invisible.
Yes, but now we're doing all those things. So get with me. I'm gonna give you Miss Soto, Bria Soto, and she can help you.
And then another situation we run into, because you said awareness, I've run into the past 3 weeks about 10 individual veterans. They say, and I asked them about the veterans, abilities and things of that nature, what they're getting. They said, no, I don't get anything because I haven't applied because I only was in for a little while and it should go to somebody that has 100%. I said, no, that's the wrong thought pattern. Yeah. I said, well, I guarantee you right now, this is what I tell them. I guarantee you right now, when you came in the military, you was as healthy as you want to be. When you got out, it doesn't matter how many years you served.
Exactly.
When you got out, you wasn't as healthy as you were when you came in. So that means something happened to your body, happened to you while you was experiencing it. 3 years, 4 years, 2 years, 90 days, something happened. And you have the right to go get checked out to see what's wrong so you can be taken care of. Well, I'm paying for through my private doctor. You shouldn't have to do that either. Yeah. You can use a private doctor.
I give you, can I 2 stories?
Yeah, well, because you're next on the agenda, and I don't want to steer too far off the Ambrosia Guillen item. Do we have anything else for Dee Dee that we need to discuss?
Good, thank you. Yeah. I know one of our biggest gaps in this town is assumptions.
Yeah.
All right. Not having the correct data. I do appreciate you 2 gentlemen right here bringing good data to the table. I threw you in the crowd, right? No, you do. You guys do. Because I hear all the time. When I talk to Tony, there's no room at the inn when it comes to the old soldiers home. Mm-hmm. I got enough Article 15 to pay for an old soldiers home door. At least I know I got some. But at the end of the day, it's not true.
Yeah, no, it's not.
And there is room at the inn. Mm-hmm. And I know Lower Valley wants their hooch down there, which makes sense. Don't get me wrong.
Absolutely.
But at the end of the day, assumptions don't build old soldiers homes. Yeah. Data does. Good data. And that's why I was wondering about the Gulf War. If you're going to up this hill of the Gulf War, is that going to require more bed space, another home? More veterans saying.
As long as they have a swimming pool, I'm signing up.
Before we go to the VA really quick, Donna Juarez is online to do public comment. Can you read public comment back here?
Yes. Let's go ahead and go to item number 4. Thank you very much. Public comment?
Yeah, absolutely. You're welcome.
Ms. Juarez, go ahead.
Hi, can you hear me?
Yes, ma'am.
Hi, good afternoon. I'm glad to be able to be present. I know that I'm limited on the time for public comment, but I would like to, I know this afternoon, Congresswoman is having a roundtable, but many of this, what I was going to share today was some great news and great shout outs for the Veterans Treatment Court. Many times in the past few years, our compliance officers, when they go out to visit our veterans in the Veterans Treatment Court, sometimes feel, uncomfortable, but there are processes and procedures to have a compliance officer visiting their home. So one of the items that came up was, can we get more females on staff? We do have a female probation officer that can help supervise. We do have a female judge advocate, a VJO from the VA. But now they have opened up a position for a compliance officer who's a female. So I thought that's a great shout out and great news as we move forward with just recognizing women issues. And with the fact of being on the topic of Veterans Treatment Court, we are looking for mentors. We have about 5 to 7 veterans who could use them. So if we could just keep our ears to the ground to see if there's anybody that would like to be a mentor to the Veterans Treatment Court, it does help those that are entangled in the justice system. And we all know that getting connected to our communities, getting connected to a battle buddy can help reduce the incidence of depression and even thinking about maybe your life not being worth living. Do I have any questions, or is public comment not open to questions, Antoinette?
Engaged, Donna, but thank you so much for waiting. And please speak on our behalf with the Congresswoman, because I will not probably make it there.
Okay, and I'll be sharing that. And then lastly, just everybody get on your calendars, 9/11, Patriots Day. There's something at Flags Across America, but I'm sure there's a lot of other things going on. Just put it on there. Let's not forget what our country has, many of our first responders have paid, given back to our country. And also just want to give a shout out for Heroes on the Water, September the 27th and 28th. The Elks Lodge is sponsoring any veteran who's homeless to homes, never could ever have the opportunity to go fishing on the water down at Elephant Butte on September 27th. Please reach out to the Elks or myself if you're wanting to get on board with that or volunteer. The following day on September 28th, for everybody that volunteered or anybody that's involved in Be the One with the American Legion, we'll have 60 spots open for families, members, veterans, active duty, first responders to be able to enjoy kayaking, beach fishing, boating, and there'll be a round robin. So mark your calendars once again for September 27th for anyone that knows a veteran that would never be able to have the chance to experience. And there's scientific evidence that shows connecting with nature can really be the very thing that actually soothes them, calms them, and then kind of grounds them. And if they're dealing with mental health issues. And September 28th for those that have volunteered or, that just want to get away, but requires a little bit of physical fitness on it too. Thank you very much and have a beautiful day. Thank you for what you do. Thank you. Thank you.
Good night.
Go to item number C. Receive update from the Paso County Veteran Service Organization, Director of Assembly.
Good afternoon, everyone. My name is Amin Lucas, and I'm the Chief of the Center for Development and Civic Engagement, the El Paso VA. Before I start, I just want to say thank you to Ms. Hunt for advocating for the VA. In the last few months, she has helped us out so much. Beginning with the boutique for the women, we did a women's boutique. We were able to get donations for about $12,000 for women. A lot of women came by, almost 200 women came by, picked up things to apply for jobs, information, women's health was pressing. We had a lot of our resources there to help women and things like that. The second one was the Vet Fest. Great success. We did our Pack That clinic. We got the back to school thing, right? So I just want to give you some numbers. So 927 backpacks with everything inside for kids, right? This is not able to give out all the backpacks. We still got 300 backpacks out of the 900, only 600, because we've been going up and down every year. So we did 200, and we did 400, and then this year, we're like, man, we got to get 600 because every time we run out of backpacks. So we went up to 900 this year, and it was a great event. So thank you for your donations. I know you used to advocate. She even when we went to the commissioner's court, we did a resolution, and that was awesome. First time I was part of something like that, so that was awesome. And then all the donations, she takes it out of her time to go and bring it to the VA and donate for all those folks. So thank you, Ms. Hunt, for doing that. And with that, I'll just give you a quick update. So as you know, like everything is changing and all these things, so I got to read this off. I know folks have a lot of questions about the administration, executive orders, and this and that. We at the Veteran Affairs here in El Paso VA, as any charge in the administration, we remain committed to our mission. We remain committed to our veterans, and that's what we're going to do. We provide the best care that we can provide for our veterans. So if anything changes, most of the things that are happening right now are internal, not external. We go through up and downs and personnel, things like that. You guys keep hearing those things. As of right now, it's not affecting the way that we provide care for our veterans. We provide the best care that we can. We are reducing the times in the community. Appointments are getting filled much quicker. Everything that we provide for them, from eligibility to support on any level, is getting there as quick as possible. So, always don't hesitate. If you guys got any questions or anything, you guys can come call, or you can come to the VA itself and give us any updates. With that, I just want to give you a couple updates about some of the things that are working well and that we are, extending. So you guys know we got the extended hours that opened up about 2 months ago, and it's going really, really well. We're getting a lot of patients that are walking in. This is for, veterans that don't want to go to the ER, that don't want to wait 2-3 hours. Okay, you can just go there after 4 o'clock. We open it to 7:30, Monday through Fridays, and it can help the veterans, with anything conditions such as, minor health conditions, cough, flu, throat aches, urinary symptoms, skin conditions, any of those things we can take care of and take care of the veteran. We'll have our pharmacies going to be open there. We got the ability to do labs and some other things that if they need to do tests and things like that, so they'll get the results right then and there. Okay, so just keep passing that on. The clinic number is 915-564-6100. 6686 is the extension. So 915-564-6100, 6686. So also we'll have Community Care Network pharmacy services will be offered also at that time. And veterans that are experiencing life-threatening emergencies, then they should call 911. But if it's something minor, we got the extended hours at the main for everyone to know.
How is the attendance on that? Are you getting good numbers?
Yes, we're getting good numbers. We started like around 5, then a little higher and 10 and stuff like that, but it's building. It's just the awareness. People are getting, they're hearing about it. So now it's picking up. So now we're getting more. I used it myself the other day. I ran out of medication and, I didn't have my pills and I was feeling really, really sick at work. I was at work. So I waited until I got out and I signed up and they took me to my primary care team. The nurse saw me within like 5 minutes of me getting admitted, and then next thing you know, they sent me down to the pharmacy. I got my pills, and I walked out. I didn't have a headache anymore. So that to tell you that it works. And I say I'm not because I work there. To tell the truth, not because I work there, but I'm not a fan of like going out to the community. I'm more of a fan now of just going to the VA and get seen. They are taking care of veterans and they're doing a great job.
How does it work when your primary care, like your primary care is right there for VA?
Right.
Okay, what if your my primary care is over on Tradeville? So
Right.
how does that work if I go?
So the great thing that we have our system, our CPRS system is linked. So all your records are pretty much in one site. It's in the clouds, but it's in one site. So any doctor that's seeing you can access those records. So, you don't have to repeat your story any million times. The doctor can actually prepare before you go in there, read your chart and see what it is that you're going to be doing. That's the cool thing about it. They see all your medications. They see everything. What was your last visit? What was the outcome of that visit? If you have anything going on, they can see all those things. They tell me right away, Mr. Rickers, I see you got this, you got that. Okay, how's this working for you? And this wasn't even my primary doctor. This is some doctor that just picked up my chart, started looking at and what I was dealing with. And automatically we're able to, okay, this is what you need.
Do you see it long term, or is it still in beta mode, or is it?
We try to keep it long term. We try to see it. It's almost like a pilot right now. So we see how it's going to work. But that's what we're trying to do. And also they got plans. Like I know we got plans to build a 24/7 access care on Tradewell on the lower and the first floor. The Horizon Clinic is going to be next year. Our main VA is already up and running. You see the bills coming up, right? So that's supposed to be done 2029. Our Las Cruces CBOC will be opening this year before the close end of the year. They're already working on just staffing and putting all the things that they need inside of the building. We also, there's a new dental coming out next year because we know we're getting more veterans that need dental services. So the VA is doing a lot of things. There's a lot of excitement going on right now. I think, everybody sees that it's not the VA of yesteryear, like Ms. Hunt was saying. This is the new VA. If you have not seen it, just come to the VA and you see how you get greeted from the minute you walk through that door. Right? Those veterans, the volunteers are going to greet you. The staff is going to greet you. You're not going to be waiting. If they see you walking around and you don't know where you're going, somebody's going to stop you and say, hey, you lost, how can I help you? To find where you need to go. You can always stop at the front desk, information receptionist. If you need a wheelchair, they'll get you a wheelchair. If they need to get you at your car on the curb, they'll get you at the car. They'll take you to your appointment. They'll bring you back. So all those things are there. It's very exciting. Even sometimes we even got the golf carts going around in the mornings just to get, right? We got the food drives on Wednesdays. It's a different VA. It's a different VA. It's not the same VA of yesteryears. We know our veterans are suffering. A lot of They have needs. They don't know how to approach. I can tell you, I ran into veterans downtown that were homeless. I brought them to the VA. They didn't even know they qualified for service. Next thing you know, they're giving me a hug. Thank you. Thank you for what? They showed me the letter. I'm like, I'm happy for you. I'm not homeless no more. So those are the things that are happening. We help veterans all the time. We just had a veteran that their home burned. We were able to get them some support, not from the VA, but from everybody else in the community, which is the best thing. This is a very close-knit community in El Paso. I never seen nothing like this. If you go, there are people calling us from all over the United States asking us, what are we doing to be number one? You know, they call us for our food drive. They call us for our primary care teams. We have folks writing, all kinds of different things on how we do our business and how we got better. And that's a thanks to everybody here in the community, just recognizing all those things that we needed in the past. And then the VA itself, the leadership, just being able to put things in place to get them fixed. Last thing, I just want to read off some of the events that we're going to be participating in. I know I'm not going to go too deep into your stuff, but I'm just going to mention that we are going to be there. So we just did a Purple Heart ceremony, August 7th. We have a whole health summit coming up August 22nd, which is this Friday. It's going to be at Donna Ana Community College. So participate. It's a new way of doing medicine. Is finding alternative medicine to the things that you deal with on a daily basis. So whole health is great. If you haven't participated in it, please come and support it. We will be attending also September 2nd and 3rd, the Borderplex Summit, Provider Summit. So it's going to be at the Starlight Center. I mean, I know he's going to talk about it a little bit more. You guys know September is big on homeless. So we're doing the homeless stand down. Please support that. That's going to be a great event. I just want to say thank you to CCU, big supporters of that stand down. So thank you, CCU. We're also going to do a barbecue. It's going to be sponsored by BFW in October. So we want to make sure that we're going to make some flyers, passing that stuff around. BFW, Surgeon General, reach out to us, and they want to do something big for El Paso, and they want to bring everybody together for that. And that we're also going to do some stand downs in Las Cruces also, because they're part of our. So that's going to be in October. So that's all I have. Any questions? Thank you for your support. Yes, ma'am.
You know me.
Yes, ma'am.
Do you still have the MST group? And this is have some veterans asking.
Yes, ma'am.
What day and what time?
I will get you the day and time.
Military sexual trauma, for people that don't know what MST is.
I'm pretty sure they're Thursdays. Let me text.
Okay.
Jackie.
Thank you, ma'am.
Check the time.
And also, this is from personal experience. An hour and a half holding the phone yesterday to call back. Another 45 minutes to hold the phone yesterday to call back. To hold the phone 30 minutes yesterday to finally get told to go to, what is the operators that do appointments?
So the call centers?
Yes. Okay. And then they called, same people I was calling, got nobody.
Okay.
That was the dental plan.
Okay.
All day.
So let me address this.
Wait a minute.
Okay.
So if it's not me, and I'm a little on the loopy side for some days, I was really grounded. I didn't cuss anybody. I didn't go shoot anybody. I was good yesterday. People lived. Only so I could come and talk to you because I knew you was going to be here. So we need to fix that system.
This is times two. Every time I call demo, and I know it, I'm the dumbest. I'm always the dumbest guy in the room. And
No, you're not.
but it's tough love. But when I called,
Got it straight.
when I finally get through, I said, it's only a single appointment. This was in June, so that was in the end of September.
Yes, sir.
So I know you're busy, but
Okay. So I think I passed this information out before, but I'm gonna address it real quick. And it's awareness and close to the loop, right?
but it seems like we get caught in that loop.
Yes. And then I think we got to do a better job. I think I spoke to the patient experience officer, Ms. Soto, about their phone numbers, right? So that let me explain how it works, right? So if you have something that's with your primary care team and you need to contact the VA for something, right? There's a phone number. I don't have it right now, but I'll make sure Ms. Hunt has it right today. We need to pass that number around. That is our normal clinic number, right? If let's say that your primary care doctor referred you to a community care appointment, right? Then you have to work those appointments through the CCS team or the CCS yeah. So that's different. So that's the thing that people don't know. And then internally, that's how it works. Sometimes when you're on the phone for too long, what happens is you get sent to Austin. And then those folks at Austin are trying to get you in contact with your teams and things like that. So that's where the
I
problem.
think with dental, they do their own appointments.
They do,
So it's not to the central appointment line.
but you still have to
But
go
you,
through.
you talk to 6 people before you get to them.
You still got to contact that same number, the 6100 number, and then the extension.
Right.
So that's what I'm gonna do. I'm gonna get you the primary care for normal circumstances, right? I'm gonna get you the number for the CCS team and the number for dental when you have to schedule. So,
But don't get me wrong, guys, it's not VA. It's only a couple people. Every time I go to VA, it's amazing.
yes.
You might want to say hi to you, walk in the front doors of VA. You're like, people will say hi.
And
It's awesome.
the one thing I want to leave on a positive note for you and the VA is, because you always got something positive.
Mm-hmm.
The only reason that we are number one is because the town hall meetings and the honesty and putting people on blast and y'all taking care of those people or removing those things. That's the reason we are number one, because you all are cleaning house and making it appropriate for veterans to get taken care of. Thank you.
That was a negatively displayed. Happy birthday.
I have a question. I spoke to, I'm going to say Dr. Ahrensman. Is she a doctor? No, she's a nurse, right?
She is the associate director.
So we spoke to her about, and I need to know, do I need to coordinate with you about her handing out our financial assistance flyers at the food drive on Wednesday mornings? So do I need to coordinate
With
with
me.
you? Okay, so we may be there tomorrow. I'm getting clarification, and I'll just confirm with you.
Yeah, you just bring them down.
But she was like, how can I connect them? And I was like, what a smart thing. Let's just put the flyers, hand them to the people as they're going through the line, and then they can reach out to us. But like, meet them where the needs at. So
as long as it's a service that's provided, like the service that's provided by this organization.
Mm-hmm.
As long as it's something like that, we are more willing to connect veterans with at the VA. The things that we don't try to connect is things like when it's a for-profit organization.
Right.
Mm-mm.
We stay away from them. But everything that's nonprofit, if you guys want to come to the food drive, I'm the one that run the food drive anyway, so you come down and more than happy, we'll walk it down the line. I should, introduce you to all the members there, and it's a good thing.
she spoke to us, but I figured it was coordination with you because you do all the volunteer stuff.
Mhm.
So I'll confirm with you today.
Yes, ma'am.
We'll be there tomorrow.
All you gotta do is just calm down and we'll get you.
Do we have anything else for the VA?
One thing after the VA, I think me and Red want to talk to Mark Real. I think we're going to meet with him once a quarter. He asked,
Okay.
get together once a quarter. We'll get you on there.
He asked for the meeting time so he can start joining us as well. So I'm going to get the next 120 days meeting times for him.
He's gonna start coming down. He just
You're welcome to join us too. You don't have to leave. You can come with me.
No, that's one thing me and Reggie think. In class, you're killing. Not in your face, so,
they always link me up all the time.
No. Thank you. Thank you. Amazing.
Yes, thank you.
All right. So not to interfere with that.
Yes, sir. Anytime, anything I can do to connect you, just let me know. Everybody in the VA is really willing to. I haven't seen nobody says, I'm not going to help you. They usually.
Something's not helping out those dates over.
Okay. Yes.
Let's go to item number 10. Receive a presentation of substance abuse program and overdose on excellent Arcan education from Paso.
Okay.
Okay.
You can come to the table. Thank you so much, Dee.
So to answer your question, it's on Thursdays at 10. It's a 16-week long group. So this one will finish in December and they'll start a new one in January. It's a closed group.
Okay, how do they get in?
They can reach out to our MST coordinator.
You probably want to sign up before that, right?
Yeah, so she makes phone calls. Let me get her contact. I was texting her personal cell. Let me get her government cell. Okay, so my name is Bambi, and I am. Hold on, I can't do two things at once.
Name like Bambi. That name's awesome. You got Lisa.
Yes, that's just Lisa.
Don't worry, I'm with you.
Okay, so I'm the harm reduction coordinator under the substance use disorder program for the VA, and this is Dr. Lisa Garcia. She is one of our pharmacists. Yes, sir.
You didn't say that.
I don't usually have a doctor to everyone. She's got good genes and good skincare. Yeah. Yeah. Okay. So International Overdose Awareness Day is August 31st. And we're trying to get naloxone or Narcan into the hands of as many veterans as possible. So just to give you some data, because this is a national epidemic. So we're in 2023 and the years prior, we were losing about 80,000 Americans to an opioid-related overdose. Last year in 2024, we lost 56,000 Americans to opioid-related overdose. So that's still 56,000 too many, but we are trending in the right direction. Heroin use is on the decline. However, our synthetic opiates, such as fentanyl, is on the rise. And there's a new-ish product, they're always one step ahead. Gas station heroin. I don't know if that's like the term. But I just saw it the other day. I was at Circle K buying some sabritones, and I saw it, and it's like, do you want to feel better or something? And they look like little 5-hour energies. But they are, there's a morphine derivative in those little things. And so they're being sold legally. It's like, it makes me think of Spice, like from like 15 years ago, and that kind of stuff. And so, they're always a step ahead. And so we know that Narcan saves lives. So, addiction, I mean, we know what it is, right? Like compulsively seeking behaviors and using substances that, despite having some of those negative consequences, still using. And we have the two types of addiction. We have substance-related addiction, anything related to like drinking or any type of illicit substance, and behavioral addictions. Pornography, sex, gambling, shopping, that kind of stuff, or a combination of the two. However, there is a lot of stigma that goes with addiction. And stigma is discrimination against an identifiable group of people, and which means they're usually treated unfairly, they're treated differently. Even within addiction, there's stigma within addiction, right? It's like, oh, well, I mean, he does heroin, like I only drink, right? So he's worse, right? So even within that, there's stigma. But what stigma does is it causes shame, and it keeps people from asking for help, from asking for what they need. So one of the things that Dr. Garcia and I are really doing is educating all of our providers at the VA, using to destigmatize the language even, so that if we have that veteran that maybe is using a little bit more, or is drinking or whatever, that they can feel comfortable asking for the help that they need, and then come through my program, and hopefully we can, help them get sober, or at minimum reduce their harm. So, this is Dr. Lisa's part.
So what we're trying to do is kind of just explain to veterans what does an opioid overdose actually look like. Because you can't be, without the knowledge, they won't be aware of how to actually treat it if it should occur. And so the reason an opioid overdose occurs is usually the brain gets too overwhelmed with too many opioids in their system. And it can happen for a variety of reasons. A lot of the times we think of overdose and we think of, unfortunately, someone on the street using illicit substances and just took too much. But it can also happen with someone who was prescribed a pain medication after a surgery. They forgot they took their pills an hour ago, so they maybe doubled up on their dose, and then they wanted to have a glass of wine at dinner. And so unfortunately, all these things are compounding that risk. So we want to teach them that opioid overdoses can be caused by a multitude of reasons, but luckily there are ways to treat it. And so an overdose, usually what happens is if a patient takes too many opioids for whatever reason, their oxygen levels start going down, their breathing levels breathing starts becoming labored. And so eventually that oxygen can start getting cut off. And so soon they become unresponsive to any stimuli. And so if you try to shake them or yell out their name, they won't be responding. And so those are times where we may want to start using naloxone or Narcan. Narcan is the brand name, naloxone is the generic. It's the same medication. And so it is actually a very effective opioid overdose reversal agent that is available for all our veterans at the VA. And so they can obtain this medication in a variety of ways. One is by talking to any of their providers, their prescribing providers, for it to get administered to them. And then the newest way that we have available for veterans to get Narcan is simply going to our outpatient pharmacy at the VA. They don't even have to have a set appointment with their provider. The pharmacist at our VA can now just distribute it to them, and we'll teach them how to use it. And it's pretty easy to use. I don't know if anyone's ever used like a nasal spray for allergies. Then you will pretty much know how to use naloxone nasal spray. So the nasal spray is the type that we give veterans here at our VA, and it usually comes. It looks like this, and it comes packaged in a box, and you usually get 2 per box. And if you notice that a person is not breathing normally and maybe having an opioid overdose, usually what you do is you just hold the nasal spray with your thumb and the plunger. You gently insert it into their nozzle, and then you just spray. And it's simple as that. It usually takes about 2 to 3 minutes for it to work. If the patient does not, or the patient or veteran does not have a response, that's where that second bottle comes in, and you would just kind of redo the same thing. Of course, by this time, we'll assume that 911 has been called, and if we need additional doses, the EMS services will be of assistance at that time. And so really, we would just like to, during this month and actually throughout the whole year, just promote Narcan as a harm reduction service that is available to help veterans, their family, or friends that may be at risk for overdose.
One of the things that I learned from working with Dr. Garcia was that overdose can happen for up to 3 hours after use. So, I think when we watch it on TV, it happens right away. But that overdose can happen 1 to 3 hours after they've used any type of opiates.
So you could take your meds and go to sleep, and in your sleep process the overdose.
Mm-hmm. So, and I think one of the other things that she has also taught me was, that response to external stimulus. So someone who's really, really high will still have a little response. You might get a grunt or something, but someone who is in overdose, there's no response. And so this is where you would want to administer naloxone. If you're unsure, still call 911, and it's not going to hurt if you administer naloxone and they're not in overdose. And I just wanted to share this picture. I don't know if you guys can see my laptop, but this happened in Baltimore in July 11th, just last month. 27 people overdosed in one day. And so the hospitals were inundated. I mean, they described it like a mass shooting, because they had all these 27 people going to 3 different hospitals. Does anyone want to take a guess how many people survived? 27. All of them survived. Every single one. Baltimore has a robust harm reduction program. And so as you can see here, there's Narcan, these are not used. So they have it everywhere. So, that we can save lives. I think often, we might think that's just another junkie. No, it's not. It could be a veteran, but it's at the end of the day, it's a human life. And of those 27, even if one gets sober, this is their wake up call, then it's worth it. But, they are human. People who use drugs are human, deserve dignity and respect. And so that's what we're here, really trying to promote our veterans getting Narcan. So if any of you guys want us to send you Narcan, we will. I have a little sign-in sheet if you guys want to sign in, last 4. And we will send it to you. My nieces are 16 and 20, so they're at that age, now they call me Bob. And so I'm like, you guys need Narc. They're like, Bob, but we don't hang out with people that use drugs. I'm like, you never know, and I'm like, and don't take it, those little pills, Bob.
Drugs.
And so I'm like, that's not a Tic Tac. You better not take, you do not take anything you don't know what it is, right? But really.
Shelf life on these? I know when I was a fire commissioner, we bought all the Narcan we could find.
Yes.
For a while, it was hard to get. We bought it for our firefighters because I see where the program be extended to. If I have it, I need it, I probably can't get to it. Where there might be a buddy plan.
Sure. Yes.
I don't want to talk about the homeless, but those guys do stick together.
Yeah, they do.
Yes. And that's another harm reduction kind of strategy, right? Of using together and make sure one person has that Narcan in case it's needed.
We did it intravenously.
Mm-hmm.
But is there a shelf life on that? Or?
Yes. So usually the prescription will be good. On the box, it'll have an expiration date. Usually it's about 2 years. I will say, you know, if it's like the day after the expiration date, the medication may start losing effectiveness after that date. But if you have, you know, the Narcan with you, I'd rather you use something than nothing at all. So it may be a little bit less effective and we may need more doses, but I would still prompt the veteran or patient, whoever, to use it. That's not to say if you, good thing about the VA is if it's expired, just let us know and we'll give you a new one. Or actually, even if you just ask for one, we'll send you one. So it's really a no questions asked at our VA.
Now, does weather or heat is a driver for its stability or not?
Correct. Yes. So we usually recommend, I actually just read this, I believe it's between 68 and like 98 degrees. Anything above like 104, it becomes a little bit, you know, less effective. So I would recommend, you know, not keeping it in your car in the full sunlight during El Paso.
That's when you kind of need it.
Exactly. So I would recommend, you know, if you keep it like at least in the shaded glove box, it may again lose a little bit of that effectiveness, but I would prefer you to have naloxone than not having any at all. So if you carry for women, if you carry a bag, and men, if you carry a bag with you, keep the Narcan in there. Yes. So I know some of us carry it in our offices and our backpacks.
I was
So
just saying that get it for our office because you just never know what might come to you.
But you're like me, because the good thing about it, you can give it to somebody who's not overdosing and it won't hurt them.
exactly.
Right.
And we always kind of teach it as, you know, kind of mirroring like a fire extinguisher, right? Like I'm never expecting anyone to go set fire to their house. Same way, I'm not expecting you. Yeah, I'm also not expecting you to plan an overdose, but it's there in case you need it.
But that's the concern we had with carrying it in our cars. That's when you're going to need it, not for yourself. You come up on somebody laying in the street. You want, you know, that thing only lasts 4 months because it's in the hot summer versus lasts the whole 2 years.
Mm-hmm.
Is there a liability issue, like say at a veteran?
Good Samaritan laws will cover you.
Okay.
Yeah, so basically the laws in Texas will differ from state to state, but for the most part, Texas and New Mexico, it's the Good Samaritan law that states as long as you're acting out of goodwill and administering the naloxone, whatever happens to the patient you are treating, it's not your responsibility. It's a claim that you're acting under goodwill.
Does the county feel the same way?
Well, if it's an employee.
Yes, that's my question. Like,
So,
if we keep it in.
I mean, generally, anyone gets sued for anything. Yeah. So there's also that.
The
so
personal responsibility.
there are defenses, but that doesn't necessarily protect you against any kind of.
That's why I asked.
But on the other hand, you want to save a life.
The other thing too is if you ever do use it, people will be probably agitated. I mean, you just took them off their high and they go into immediate withdrawal. So it's like administer and take a step back, you know, because they're going to probably be highly agitated and disoriented too. And so it can be quite traumatic using naloxone because, well, one, like someone is dying in front of you, you know, they're overdosing, so you know they're dying, and then they're going to be extremely agitated and not feeling good at all. So, but I'd rather have somebody angry than somebody dead. So yes. And then just to briefly let you know of what we have to offer. We work with the Veterans Treatment Court, the Substance Use Disorder Program. So we have an intensive outpatient, a face-to-face, as well as a virtual intensive outpatient. We have MRT groups. It stands for Moral Recognition Groups. And so that is helping veterans like transition back into like civilian life once that, you know, if they've been incarcerated, and then various outpatient groups and individual groups. And so all our services, we have virtual and in person. I also run the contingency management program. It hasn't been quite as successful, but this is where for any stimulant users, it is evidence-based and it's a reward-based program to encourage people to stay sober from stimulants. And I can get them to start. It's a 12-week program, but getting them to come twice a week for 12 weeks, I think I've only had one since I took it over that has been successful. But they, we do 2 urine tests. I mean, because it takes like 15 minutes. We do the urine test, I check it, and then they get VA bucks. And so like we give them money, but it can only be spent at the VA store or in the canteen. So there, we do have quite a bit of services for anyone struggling with any type of substance use disorder. If you need any more information or you come across a veteran that's like, I need some, anything with substances, my government cell is 915-219. I couldn't bring any with me. 219-2053.
Non-military, non-veteran in the community, do you partner with any other organizations or institutions for people that may not have insurance but need help with drug addictions?
So there's Trinity, Casa Vida. So the El Paso Harm Reduction Alliance, they're not quite a 501c3. It's just a group of people that have really come together. Punta de Partido, I think, is another one. Punta. DE. And then Partido, Partido. And so they, they have a lot of programs, and they also do a lot of harm reduction. I used to go out with them to do street outreach, and we're just looking for people to give them, wound care, hygiene kits, smoking kits. I mean, we know people are using, and so it's like, how can we reduce that use? And make it safer. And then it's not, what we know is harm reduction works. The old school of, it's either sobriety or nothing, that didn't work that well either. So harm reduction efforts work, right? Like the buddy system or, unfortunately, Texas doesn't have sterile syringe programs, but I mean, they work. They work. Or fentanyl test strips, hopefully we'll get there. Hopefully.
I have just a quick question that's not substance abuse related. So if a veteran has another addiction, like shopping, or how do we help them from...
Take their MasterCard.
Well, other than like fiduciary or something extreme, how can, what is it? I mean, is that something that can be diagnosed?
So not diagnosable, but then there's probably some underlying stuff, like probably some anxiety that goes along with it. So if they come to like our behavioral health clinic, we can kind of work on what are the underlying issues. I mean, what we know with addiction is, it starts off as fun, but it's usually, it's a coping mechanism.
It is.
Right. And so we got to figure out a better way of coping, and we got to get to that underlying issue of what's fueling, let's say, the shopping. So diagnosable, the only behavioral one that's diagnosable at this time is gambling, because that's the only one that's in our diagnostic and statistics manual.
I recently came about that, and I don't know what resources we have for like a veteran that's going through that, but we can see like their financial awareness is not where it should be. Mm-hmm. So I don't know what options we have other than like fiduciary or.
And I even think the behavioral health services, because again, there's something that's fueling that, right? When they get a hit of dopamine, and so it feels good, but then there's shame after, because it's like, I shouldn't have bought that, so then, it's just this vicious cycle, and that's, yeah.
Thank you so much.
Mm-hmm.
Are there any other questions?
Thank you. Thank you so much. We will get this Narcan out to you. Thank you. Thank you. Have a great rest of your day. And thank you for the empanada. They were delicious.
Let's go to item E. Receive an update from the City of El Paso Program Coordinator regarding veteran issues. Mr. Jones.
Hey guys, Luca Jones here, City of El Paso Veterans Program Coordinator. I'll make this really quick. You guys know about a lot of this stuff. So the first thing is that Borderplex Veterans Service Provider Summit, which is going to be September 2nd and 3rd. I passed it out to you guys. That should be the finalized agenda there. It's a 2-day thing. It's closed. It's for service providers only, not a tabling event. We're going to have like real world issues discussed during our panels, and we have subject matter experts coming in to kind of moderate some of the panels, keep things going. Outside of that, as Amin mentioned, we got the VA homeless stand down September 12th. We're still collecting canned goods for that. you can give them to me. Thank you to both and everyone else that's supplied me with cans. But then also, if you can't find me, right at City Hall, up or down the street, however you see it, there's right in front of HR when you enter, there's a big box there if you'd like to put the cans there too. We're planning and we're getting prepared. We're going through the planning stages to support the Rio Grande Honor Flight, which is going to depart the 25th of September at very early in the morning, around 6:20. And then they're going to return September 27th around 4 p.m. And this is where we take our Vietnam, Korean War, sometimes World War II veterans to see the memorials in Washington, D.C. They're in their honor. So if you can come out and support, wave a flag, shake a hand, it's a good thing. Coming up this week on Thursday, we have our Veteran Affairs Advisory Committee meeting. We put in the resolution to change our name. So you guys will see the new name here pretty soon.
This is Thursday, right?
This Thursday at 10 a.m. Yep, at City Hall.
What's the new name?
The VAC. It'll just still be the VAC.
Just 1A, right?
Yeah,
You took the affairs out?
I think so. I think it's going to be Veteran Advisory Committee.
That's
Yeah. And then our next Coffee with Veterans will be September 4th at the EPCC Veterans Resource Center at Valverde campus. And that's 8:30 to 10:30. The department will be attending next month's Texas State Homeless Conference in Austin, trying to see what information we can bring, best practices throughout the state, who's doing it well, who's not. For the VA homeless surge that we had last month, I know some of you guys took part of it, but I'm not sure if you guys all got the data, but I have just some quick data from that. So just based on the 3-day event that we did, we contacted over 300 plus individuals who were homeless, unhoused. Out of that, 27 of them identified themselves as veterans. And then out of the total of all of the people, just for that 3-day event, we took 40 plus people off the streets those days. So very, very good. I know John Martin will tell you, if you talk to him too, we've done data before on homeless individuals in El Paso and probably ran into about 180. And so we contacted over 300 in just 3 days. So there's definitely the data, there's more homeless than what the data shows. Outside of that, if you just things that you guys can support me with, the honor flight, I put a flyer up on LinkedIn. We're not running that, but we'd support it, and we want to make sure they're getting supported. The summit, if you guys can come out to the summit, I think most of you guys have already got your tickets. And then just make sure I have it. Oh, and then thank you guys. We got we're getting ready. I've already got individuals that are planning to submit their nomination for Veteran of the Year. So thank you guys for getting that going. It's easy to follow, easy to understand, right on the county's website. So good job. That's all.
Where's your Coffee with Veterans at the EPCs? At the library?
At the Veterans Resource Center at Valverde.
You send something out on that, or is this on here?
He sends it out.
I haven't sent out the coffee thing yet.
Okay.
I usually wait about a week or 2 weeks before, but yeah, that's the most pending stuff there.
Right, let's go to item F, receive an update from the El Paso County Veteran Assistance Office.
Okay, well, we kind of briefed everything that we've done because we did most of the same things Lisa did. The Purple Heart. Mr. Porras had a very good event at his American Legion Post 36 for their 105th birthday, so I was there for that. And Veterans at Breakfast Barbecue. Last weekend, I went to the El Paso History Museum for Melissa's Women Veterans exhibit. It's only there temporary, so if you get a chance and you want to go check it out, these are veterans from the El Paso area. Mike came out with us for Vet Fest, and we had a good old time handing out R&B stuff and talking to veterans, so thank you to Mike for that. And as Luther said, the Veteran of the Year nominations, I sent you all a Facebook link. If you can share it to your page. There is a press release hopefully going out today for that. I've already started receiving nominations, so as I receive them, I'm building a folder with the name and 5 veteran, whatever nominations come in for them. So then later I can redact them and we know what's what. But all that's going well. Just to let you know, our grant is up and running, even though it wasn't approved by Commissioners Court until July 7th. But in July, we were expected to meet a 7% marker, and we actually hit 8.12. So we are extremely busy with the grant. Our office, if you came before the grant and it was kind of calm and a relaxed environment, it's not that anymore. And if you call me and I don't answer, that's probably why, because I'm actively trying to help as many veterans as we can. So if they need me to reach out to somebody to get something done, then I do so. The other thing I passed around, and it conflicts with the Service Provider Summit, but I already talked to Luther. The Fabens Veterans Memorial groundbreaking is September 2nd at 9:30 a.m. So I will be there to support this, and I'll probably split the baby with the office to make sure that we support the summit as well. But if you can get out there, please support the Fabens. The memorial that they're building is very beautiful. And my plan or my hope is that when we do finally ribbon cut that location, I have more.
No, you're good.
That when I ribbon cut that location, that we do a huge resource fair like we did Veterans at the Park back in May. And we take all these resources so that the people in the lower valley know what resources, because I think it's just about education. There are things out there that if you don't know about, you don't know how to access them. And we just need to start educating and making sure that we're one unit. So I think that's the big thing. Are there any questions for me?
Let's go to item G. Discuss and take appropriate action concerning the 2025-26 Veteran of the Year selection.
Okay, so I kind of covered that. Do you have any questions of me about the process and how it's going?
Guys, when you set the meeting for this, try to make it the year if you can. No, your commissioner will want you here. My assumption is it will, because veterans, they want their vote in there. So we'll work the details out. Devil's in there somewhere. Try to make it that day. Vote.
Go to item H. Discuss and take appropriate action regarding Veteran Advisory Board short and long-term goals for 2025.
So the big thing here is that the resource guide is done. So I shared it with y'all just to kind of show.
Yeah, it looks really
good. And it's really like my plan is 2 clicks, right? What's your issue and 2 clicks. So I immediately saw this space was missing when I sent it to you, the financial assistance square. I reached out to communications and I asked them, can they just build a financial assistance square and then link it back to our page, because our page already has our grant and alternate sources for financial assistance. So we did that. Were you able to go, and this isn't live yet because communications is waiting for us to give some kind of input. But I told them that we would discuss it here. So is there any input?
It was easy access, easy to click, easy to read it and figure out if that's where you needed to be for that particular resource. And then when you hit the button, the link, then it dropped down and had a bunch of stuff that you could just, whatever was your issue, you could have picked one. And then it was easy.
Anything that we need to correct?
Great work. So we go forward and do an assessment in 6 months, see where we're at, unless there's something comes up before that where we have to a quick change step. Other than that.
Okay. I know that some of the commissioners were watching this very closely, so when it goes live, you can report to your commissioner that that's mission complete. Now we just have to maintain it, make sure that we're checking on it periodically. Because it's digital now, we don't have to reprint something. We just need to go in and once in a while check the resources, make sure the links still work, make sure someone's answering the phone. If there's new resources that fall under that category, like say what was the name of
White
it?
Acres?
White Acres came and spoke to the back, and they're a living facility that runs off of aid and attendance. So like if that's something, they're for profit. So if that's something that we wanted to add, then we need to figure out how, and we can discuss at the next meeting. What's the steps? Like, do we want to form? Do we want to label it as this is a for-profit organization? So there's money involved that veterans don't, so veterans are not confused that this is going to cost money, because free things and costing things are very different to veterans. So any issues there? Okay.
Do we need a motion to move forward?
No.
Okay.
So just directing staff to go live with the, okay.
How are we gonna get this out to the public?
I'm
Maybe aware of it, anything like that.
I'm probably going to put a link on it from the Veterans Capital page, because that's a big place where people go. And then I'm probably going to do with it what I did for the nominations, is create a link and then send it out just like on our page that we can share. And even like, I know the city has a resource page too. Maybe we can collaborate and
We'll put the link up.
and just the more information we have, and I like this because it's literally 2 clicks. Like
The IT person doesn't really even vet me. I'll tell them things like as a joke and like, I'll put Pizza Hut on there, whatever. It'll go on there. Sure. You guys are good.
Okay. Any issues there? Next item.
Right, go to item I. Receive policy updates from the Veteran Advisory Board on any items of interest or issues from the representative of Veterans. Precinct 1, Smart.
One thing I got, they went to the back copy, real good. I don't like the format they had. I think, what was that? Auditorium style, you know, but great time.
Yeah.
Great call.
That was a check the block. Let's get in a national park deal. So.
No, it was, it was hard.
That's how we got the congresswoman out there. If we'd have done it at VFW, she'd have said, I'll be at the next one.
Yeah, got it. September 2nd for your thing, I signed up. I just came down to jury duty. Oh boy. But there's 2 things going on. Just on track on September 2nd. But the favorite thing as well as signed up for Vortex. Precinct 1. You know, we got a lot of stuff moving out there in Precinct 1. They got the new payment camp going up. A lot of controversy on that, but not for veterans. You know what I'm saying?
There's already people in there.
Yeah.
It's about 1,000 moving fast.
Really?
I thought it wasn't even built, I guess.
No. We had 2 visitors that were not happy.
But it's not going to be a brick and mortar. It's tents.
Yeah, it's tents.
Yeah.
Oh,
It's
so when they say build something, in my mind, I'm thinking you're gonna put up 4 walls.
No, that's military.
Oh, okay, so that's how it happened so quick.
Yeah.
Hey, give me like 15 Joes, we got
But at the end
this.
of the day, no, we take care of veterans. You know, whether it's that or not.
And
More
this
jobs.
And this is supposed to be easier process because they don't have any jurisdiction. They're supposed to be processed and sent back. My understanding. But they just don't like the conditions. Yeah, but they don't like the conditions because of the tents and the heat here.
Sure.
That's it.
So I got.
Thank you, sir. Precinct 2.
Precinct 2, though, they just wanted me to find out how we were gonna launch the resource guide, what's gonna be the process. And they wanted me to find out about QR codes, if we're gonna use that.
Oh, I can ask IT. I think IT can do that, right? Make me a QR code. We can do QR codes and make flyers.
And whether or not, if we thought about doing press conference or something like that to let it be known that it's going out.
It's a resource guide.
They said it's funding, that's what PA says, possibility to get some funding and business cards. But what are we doing about business cards?
That's one thing I was going to tell you one day. I'm working on a business card now. I'm going to show you all something simple that has a website on there, phone number, there's no emails. No emails.
Yeah.
That way, everyone's asking me for a business card. Everywhere's like, it's tiresome.
It is.
You know, I ran out of sticky pads. Those that have, you can buy those fancy ones, the .com ones.
I love that. I think that's.
It's this card here. I don't I don't recommend it because it's a huge learning curve. It's what you just, when you phone next to it,
Yeah.
download all your
All your
data.
stuff.
And when we deal with the veteran world, except for Luther's like over 60. So, you know, they want something they want that hard business card. So somebody can look at, you're right, though. Yeah, have a link on there.
And maybe we can, I hadn't thought about launching it, but I'll talk to communications about maybe doing a flyer and putting the QR code on the flyer, and then maybe doing like an announcement. But really, this is kind of your project. So if you guys want to do
we're the best one to launch it, I think.
press release,
Look at it.
Just a suggestion, you know, I think it's every Monday or whatever, when the judge does his little opening on Facebook or whatever, that we know when maybe one of us or all of us can join him.
I think he'd be
As
down
he's,
with that.
as he's saying it, we're there supporting it.
On that crap you guys do. On the screen when they're doing executive
whole
session
screen?
for 7 hours.
Right.
The whole screen?
Maybe,
Yeah.
maybe,
You guys
maybe
can
a
do
QR
something.
code.
I'll talk to Dr. Gallegos and see what she wants to do, but like, because it hadn't been done, I hadn't even really started to consider how we get that out, but I think it's a good thing and we want to get it out. So I will definitely launch it on Facebook. I'll ask him when it's going to live official, and maybe we can work something
I
out.
think all our commissioners have blocked. I know Jackie does one every Monday. I haven't put it out to that. So
They all do live, and they all have
Instagram account.
they all have social media. And so what I did with the nominee thing is I shared it to our Facebook, and then I let Desiree know at communications, like, can you share it across? So they'll post it to parks, they'll post it to all the other county social media pages, and it goes out far and wide. So we can do that, and then maybe we can work on a flyer and maybe even a press conference, and I can talk to Mr. Castillo from the judge's office to see if maybe you want to join him on a Monday. So also know, so I talked to, I think, Mike and Reggie about this. Senate Bill 6, and am I saying it right, Mr. Martinez? There was a law passed that starting 1 September, all meetings have to be posted 3 full working days prior to the meeting.
Yeah.
So the agenda for this meeting will now be posted on Wednesday prior, which means on Monday, I'm running a draft and meeting with my chair and vice chair to scrub it. And by that day, I need to know who our special guests, if any, are coming. And then on Tuesday, I send it for legal review. And then Wednesday, and then the county clerks for stamping. And then Wednesday morning, I like to get it done early. We publish it so that people understand. But that's changing across the board. That's changing for commissioners court. So it's changing the battle rhythm almost every office in this building. So understand that resolutions are going to change. They're going to have resolution days, and they're going to have business only days, is what I understood. So resolutions may change. I had a couple in the waiting to get done, and now they may get pushed to October. So just FYI, we're going to go through some growing pains as we adjust that. You know, we like our schedules and we don't like changes to our schedules, but it's going to be some growing pains, and we'll deal with that as is.
Listen to, that's it, sir. Last thing, I talked to a commissioner, and because he's talking to me about it's coming up, because I just took somebody's seat. He said he asked me if I wanted to remain on board, and I just walked away from him.
No, you didn't.
No, I told him, yeah, I'd be honored to represent
I was like, I just wrote this glowing report for you. What are you talking about?
ChatGPT said you're doing great.
Hey, someone said it.
that was it.
Okay, thank you so much.
Okay, thank you. Precinct 3, Mr. Zero.
Yeah, there is nothing this month because the Lower Valley canceled their meeting for last month, so. Yeah, they did.
Well, I was there.
We're there last month.
No, I was there in July and August.
We were here both.
Yeah, they had a meeting in August.
They sure did.
Well,
You were
I missed
there.
that one.
You did, and it was packed.
Yeah, I was there in August to talk about the nominations and stuff. But they did have a meeting, just Javier wasn't there. So next time I'll text you just to make sure. But the next meeting is canceled because we'll be at Faven's to do the groundbreaking. And then we'll meet again in October. Go ahead.
All right. Precinct 4, Wakefield?
I've been out of the net, so I haven't dealt with my commissioner. I'll stop in on the way out.
Hey,
I did go to Las Vegas as a delegate for the Disabled Veterans Conference. I do not gamble, so I did not lose the $10 that the hotel gave me to spend on a machine. The one resolution that got passed that is very, very influential, because it hasn't had one passed. I got it. Is the support legislation to include Puerto Rico as a DOD and VA recognized location of Agent Orange and other herbicides used. It was adopted and everybody voted 100% to make it go. It will now go to Congress. It's the first bill that's ever left our area under our jurisdiction that we could push for. And because David Garcia, as well as Antoinette Hunt, she had a veteran that had the same issues. She's been fighting for that veteran. And she gave it, basically said, okay, if you want to run with it and put it in, because he does a lot of the soliciting and lobbying. And actually it went through. And so that's going to be the first for El Paso. And that's what, again, keeps us veteran capital, because we do stuff and get it done.
So kudos to Dave for writing that resolution and pushing it up. We still have a fight. It's going to be a long fight too, because for Puerto Rico to acknowledge that they used Agent Orange means that the U.S. government will have to acknowledge they gave people cancer that live there. And that's more of a fight than the actual veterans who are still fighting for their benefits, like the people who live there who have been poisoned. But to my knowledge, I did some research. No veteran service organization in the El Paso area has ever written a resolution that went to national. So it is a big deal. We will acknowledge that at Commissioner's Court in the coming weeks when we figure out the resolution schedule. But it is a big deal. So when you heard when Dave first spoke to me about it, I was like, what? I had to confirm. And it is actually a big deal.
Actually, it started with Tony, so she should get the key.
It did start with her and her veteran.
But we found it in our office, based on that veteran that came first.
But it just shows how we work together. So like we saw an issue, I went to somebody I thought could help the issue. He ran with it and he has been fighting. It's been like 2 years because this is one of the first veterans I met with when I started the job. So it's just another reason why El Paso is getting it right. And it's all of us working together. I don't think any one of us can say I did this by myself. It's all working together.
Sometimes you can. And we had 615 resolutions to go through. And trust me, they did not banter on one. They went through every single one, line by line, because that's how important every issue was for them. And so you will probably see a few more. I think Fort McClellan is another one that has chemical issues, and as well as Camp Lejeune. So those two are probably going to get pushed forward again because of their severity. That's just not coming. But yeah, thank you.
All right, and then County Judge Hoyne absent. We'll do item adjourned.
And for that, and special thanks to, I think goes to, I think you helped our mailman. Your mailman come to you? Ready? Mailman? Our mailman?
Yeah.
And he got 100%?
Yes.
You got on the sense of it?
Look for it right now, I got it here. Scruffy looking.
No, that's all of them. They go between soap and water, they all.
But thank you.
What's the town hall thing today?
It's a women veterans town hall. It starts at 3 o'clock.
Isn't it online?
And it's for women veteran issues, but
She's doing the spouse thing on Friday, right?
yes.
Okay. Thank you.
It's online, Tony, no?
No. I think it's actually his place. I didn't get a link for it, so. I told Melissa that the VAT nearly almost always goes to 3, and I probably would make it, because I'm not gonna try to beat traffic. And then I get there.
Yeah.
Do we get a motion to adjourn?
I motion to adjourn. Second it.
All in favor? Anyone opposed? Motion carries.
You guys did great.
I gotta check.